Fillers often get sensationalized. All of a sudden, we think, oh yeah, there's those bad fillers that make everybody look like ducks and make them look, or they look overinflated, over-injected, and it doesn't look good and doesn't look natural. Of course, if 10 people in the room had injectables and 9 looked great, we're always going to recognize the one that didn't look great. Fillers are probably the best one thing we have in our armamentarium to make patients look way better, way more rested, very natural, if it's done appropriately and by somebody who's skilled at doing injectables. Facial aging is 3 major things. It is changes in your skin, fine lines, wrinkles, pigmentation, sun damage, all that stuff. It is a loss of volume. And then finally, it's some sagging that occurs. We should restore volume first and see how we get. And that takes care of most of my patients. But on the other hand, if somebody really has a sagging problem, we should not try to fill them up all the way to fill up all their sag, right? We probably need to deal with some sag. But for most patients who are in their 30s and 40s and early 50s, most of them can be treated just with fillers and with restoring volume, and they'll get a much more rested and youthful look without looking fake. Today we have many choices of fillers. We have a very, very thin filler called Restylane Silk, which can go around the lip lines. It doesn't add any lift or sort of bulging volume to the lips. It simply fills in the lines and the wrinkles. We kind of call that airbrush filling, or I call it lipstick filling, making it look like you have really just nice lipstick, sort of making everything look great. If you're doing a cheek and you want to get a lift, what you want is lift, we have products like Voluma and Perlane and Radiesse that we can actually inject. It's a little stiffer, a little thicker. It's there to lift the structures. It's not there to really fill in wrinkles, it's there to lift the structures. So if you use the right product in the right location, you can deliver great results that are predictable and satisfying and usually last at least 1 year.